No matter your age, your plan for retirement can start today. From the News Channel 5 Network, this is the Retirement Report.
Good morning. Welcome to the Retirement Report. I'm Hank Parrott, your host. We're going to be talking, we've been talking about Social Security and Medicare and some things here recently, and I want to I'm going to finish off some things there with regard to Medicare. These are really important subjects that are going to have a huge impact on your retirement. One of them, for instance, Social Security. We're talking about, there are a lot of different filing strategies, and we talked about some of the key ages. That for Social Security, this will be age 62. That's the first time at which you can qualify to start taking Social Security. We're going to delve into some of the rules around whether you should or you shouldn't. The next is age 66, 67. That's full retirement age, somewhere in there depending on your age currently. And that simply means there's another marker as to when you get what they refer to as your full retirement benefit. Okay, now you can actually though get an even higher benefit, and that's if you wait until age 70. So here's something to consider. Between age 62 and age 66 to 67, again depending on your age, you're looking at about a 20, let's say 66 for those that are looking at retirement right now. You're looking at a 25% difference in terms of how much you would receive taking it 62 versus 66. So in other words, if you qualified for receiving $1,200, let's say at age 62, then that means you would get $1,500 if you waited until age 66. Now, per month. Now, let's take that a step further. If you wait till age 70, then you would get what are called delayed retirement credits. Now you're getting an extra 8% per year, or a 32% increase over that amount, which would add another, potentially another $500 per month to your Social Security benefits. So the difference then between age 62, filing for your benefits at that point, let's say again using that example of $1,200 a month, would be getting $2,000 a month at age 70. Now you'll get your statements from Social Security, or you can go online at ssa.gov and you can sign, you can basically register so that you can go online and get statements at any time and check the status of those benefits. But we're going to talk about some of the things that they don't tell you there, and that's how you apply these rules with regard to your planning. Because it's, knowing that, okay, age 62, something you can say, well, I'm going to get it as soon as I can because it may not be there in the future. I've had clients worry about that. At age 66, the thought is, well, if I wait till age 66 and I retire then, that's got to be my optimum time, and I don't want to wait any longer. Who knows how long I might live? And that's a valid consideration. Keep in mind, though, in particular for a couple, let's say if the husband is has been the one that's been the high earner, and if you delay then until age 70 for that husband, this could help in particular for your spouse. Since women typically live longer, one of the benefits is at age 70, if you wait, you've got the highest benefit now. If something happens to you, that benefit then would be available to your spouse. Okay, so this is one of the considerations when it comes to planning and as to when you take Social Security. In particular, if there's a big age difference maybe between the husband and wife, this could play another role in terms of that decision. So as you see, when it gets there's no pat answer, is there? It's so individual in terms of your particular situation is what's going to be the best decision to make, and this is going to be with Medicare and healthcare decisions too. And understand how important these decisions are. Once you make them, okay, it's very difficult to change. There are only rare exceptions that would allow us to make a change. In most instances, when it comes to once you started taking Social Security, you're kind of stuck with it. I mean, there's one exception that allows within the first year for you to maybe change your mind and pay back the money and start over. But for most instances, when you take it, you're that's it. So we're going to talk about Social Security this morning and some of the risks that go with this. These decisions are so important. Recently, there was for the first time, in fact, we're seeing how much does Social Security actually represent for most people with regard to income and retirement. And the number that's put out there is it's about 40% of your pre-retirement income. So imagine now, if, for most of us, right, To think that all of a sudden you're going to be able to live on 40% of what you have been used to living on, that's not very realistic, is it? So now the other part is, if you have a pension, that can help make up some difference. Okay, for federal employees, for instance, I'm going to use that example because it's one that, the pension part can vary according to the company, but it's usually based on years of service and the amount you've paid in and how much your earnings were when you retired. They get into these formulas that, in essence, come down to about maybe 20-25% of your pre-retirement income. Maybe if you worked a very long time, you might get even 30 or 35% or more. So again, if you put those together, you're still looking at taking somewhere between a 25 to 35% pay cut if you just try to live on those things alone. Or as I said, if it's Social Security alone, that'd be a 60% pay cut. So how do you make up the difference? Well, this is where the savings are so important, right? See, when our parents and our grandparents were planning for their retirement, it was a little different. If you think about it, their base was that of their pension. That was the biggest part, and then the next part was going to be Social Security, and the very last and smallest piece to the puzzle usually was the amount of savings they had. Today, that's been completely turned upside down to where the biggest piece is our savings, then Social Security, and for those that have a pension, it's usually a very small part of what's going to make up our income in retirement. So when we look at planning for retirement, this is where it's so important. One, on that Social Security piece of the puzzle, that's going to make up about 40%. Is how to maximize those benefits. And here's another important part. Social Security benefits can be taxed depending on how much money you're pulling from your IRA, or excuse me, but how much income you have, but also that means your taxable income, which means also how much you take from your retirement accounts. So understand, this is kind of important, right? And when you're planning for your retirement, understanding these rules. Okay, it's not just, oh, I can take it 62, let me take it 62. Let's do a little more of an analysis. Is that the best time? And what are my alternatives? And in the end, what's going to give me the best odds of not running out of money and of being able to maintain that standard of living and quality of life you've worked so hard for? All right. Now I'm going to make this easy. We're going to get into it this morning, and I'm going to try to give you a lot of tips to help with that, including those healthcare decisions you're going to be making in retirement. But I'm also going to offer for the first 10 callers to my office this morning at 615-376-5325. I'll help you with this analysis. Again, this is not just a free consultation. I'm not saying come in and meet with me for an hour and I'll answer a few questions and that'll be that. No, we're going to do a full plan for you. We're going to help you answer all the questions I raise here each and every week on the retirement report, okay? Things that are so important. When to take Social Security. What about the Medicare decision? And we're going to get into health care costs. How do I cover that, estimated $200,000 to $300,000 out-of-pocket costs in retirement? What's the best plan for that? How about my investments? Am I invested in properly to make sure I don't run out of money and I get the most growth and don't have to worry about things like inflation and market crashes and losing my money, and then where am I at, or running out of money, God forbid? Then what am I stuck with? All right, all of those questions we answer for you, give you a view into your financial future. And with that, when you call the office, Debbie will get your information. She'll send you out a little checklist of documents to bring to the appointment with me so that we can do all this planning for you. We're going to do a full financial plan for you. All right, all at no cost. And I'm going to send you a copy of my book, 7 Steps to Financial Freedom in Retirement. This again lays out the same kind of planning that we do, and we're going to help be your coach and walk you through and do that plan for you, and then show you what your options are, so that the decisions you make today, you'll be able to see what the impact of those decisions will be in the future, 10, 15, 20 years or more down the road, to help you make the best decisions for you. All right? But we're going to get into a lot this morning, so I want you to stick around because we're going to take a quick break and then we'll be back here on the Retirement Report.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Hello, everyone. I'm Ron Howes from the Storm 5 HD Weather Center. You're looking at radar now, showing any precipitation out there on this Thursday night. And here's a look at temperatures across the southeastern U.S. and the current conditions now in Nashville. Our forecast for tonight, partly cloudy, an overnight low of 42 on the 7-day forecast. Another nice day tomorrow, 68 the high. Cooler temperatures coming in on Saturday and Sunday with a 30% chance of showers Saturday. By Sunday night, possibility of freezing temperatures in many areas. 53 on Monday, back to 67 on Tuesday. Temperatures in the low 70s for Wednesday and Thursday, but increasing rain chances by the middle and end of next week. This has been a weather update from the Storm 5 HD Weather Center.
I'm a firefighter.
A teacher.
I'm a farmer.
I'm a barber.
A waitress.
A mom.
We're all part of your community. Every day we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good,
others not so much.
But that's life. It's when you experience a moment of uncertainty. Something or someone's behavior that doesn't seem quite right.
These are the moments to take a pause.
Because if something doesn't feel right, it's probably not.
It's not about paranoia
or being afraid.
It's about standing up and protecting our communities.
One detail at a time.
Because a lot of little details can become a pattern.
We
trust our instincts.
Just like you should.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, I was talking about Social Security and Medicare and, of course, some of the risks that you're going to be facing in retirement. I'm going to pick up on something, and this in particular, as I mentioned with Social Security, there are certain key ages. So at age 62, as an example, that's the first time you can apply for and get Social Security income benefits. Now, let me give you a couple of caveats on this. If you take at age 62, okay, there is one thing you must keep in mind, actually two things. The first being that if you continue to work after taking those benefits, and you make approximately $15,000 or more, okay, if you make over $15,000, then for every $2 that you make over $15,000, they're going to take back $1 of those Social Security benefits you're receiving. So you're going to get a reduction in those benefits. This is one reason I always recommend, if someone's going to be working past age 62 and they're going to be making that kind of money, that they definitely want to postpone taking Social Security. Now here's the second part. Social Security benefits at 62 and for the rest of your life, for that matter, are potentially taxable, depending on, in fact, how much income you have. So, for instance, for someone that's single, you take half of whatever Social Security benefits you're going to receive, then you add in, if you're taking money from a retirement account, that counts. If you have wages, of course, that counts. Interest from municipal bonds, that counts. So possibly investment income, in other words, is also going to factor in here. You add all that up on your investment income, your dividends, your capital gains are going to affect it. All of these things could cause you to have to pay tax on your Social Security benefits, and that could be as much as 85% of your Social Security benefits could be taxable. Okay, so to put that in perspective, that means if you would be receiving $30,000 a year in Social Security benefits, then $25,000 of that could be taxable income. And depending on your tax bracket, how much you're making, if you're in a 15% bracket, well, there goes approximately $5,000 in taxes. Okay, or excuse me, about $4,000 in taxes. If you're in a 25% bracket, then you're looking at about $6,000 in taxes. So think about that. Now, if you're $30,000 all of a sudden just got knocked down by anywhere from $4,000 to $6,000 in taxes you have to pay, so that your net of what you actually are getting is going to be somewhere around 24 to 26. And then we're going to get into the health care part, because how does that play in? At age 65, this is another key age, that's when you first qualify to receive Medicare benefits. And you need to apply for those benefits 3 months prior to reaching age 65. And understand, even if you're going to continue to work past age 65, and even if you have health care benefits through your employer, you still need to apply to Medicare. Okay, don't miss that. That's something you need to do. And usually your health insurance through work is now going to be secondary to that primary is going to be Social Security or Medicare. And that in particular, so your hospitalization benefit, and we're going to break these down for you as to what Medicare makes up for you on the amount of tax and stuff that you're going to have to, on the amount of benefit that you're going to receive. All right, so as an example, 65 now you qualify for Medicare. Keeping in mind, you've got the Part A, Part B, okay, which is your Part A is hospitalization, Part B is outpatient. Then we're going to talk about Part C, Medicare Advantage plans, and Part D, prescription plans. We're also going to get into Medicare supplement plans because this is going to be a key part to how much you're out of pocket. Again, estimates are saying $200 for a couple age 65. You can expect between $200,000 to $300,000 in out-of-pocket costs, what you're going to have to pay over and above what Medicare pays. All right, we've got a caller, so we're going to take a quick call from Antonio. Welcome to the Retirement Report.
Yes, how you doing?
Very good, sir.
And good morning.
How can I help you this morning?
All right. I was asking, I was in the military.
Okay.
Now I was married for 2 times. And I'm 58, I'm going on 59. And I didn't know when should I need to apply for Social Security and about how much I probably would get back if I filed early, like at 62.
Right, so you're retired from the military now?
No, sir, I'm not retired. I just got out of the military for 4.5 years. And I'm still like, I have, what you call it, I got out of the Army, which was armed with discharge.
Okay.
And now I was working like I was homeless in Nashville, Tennessee.
Right.
Then I just working odd jobs here, odd jobs there, and odd jobs there. And I fill out my tax the tax receipt.
Uh-huh.
And everything I did was, only legit. I had money and stuff taken out. Now I want to. I'm not retired. I'm still working a little bit, here and there.
Okay.
And I want to file at 62 instead of waiting to 70 years old and stuff.
Right. And it's to, so yes, you can. If you're going to be working, though, and making more, and if you're making less than $15,000 a year and you apply at age 62, then that's not going to impact your you're losing any of your benefits, so that might make sense for you. One of the things to look at, of course, the longer you live, sometimes postponing can be a benefit there, but these were some of the considerations. The other is on 62. Again, that's for Social Security benefits, not health care benefits, so making sure you got that health care part of it, whether it's individual insurance or through an employer, is still an important thing for you. So yes, you can apply at age 62 for your Social Security benefits as long as your income is not over 15, that won't be impacted. And even on taxation of Social Security benefits, depending on how much you're going to receive from Social Security, if you're receiving, say, $20,000 or less, and usually when you're taking at 62, that would be the case, then and you're making, again, $15,000 or less, then you shouldn't have to worry about taxation of those benefits.
So it's a good thing for me to just file at 62? The way I'm working, sound like homeless, and, not trying to make $1 million a year and stuff like that.
Right, and this is the other part of it. If in fact that you're struggling financially and you're just working on a part-time basis, then most likely taking Social Security early is going to make more sense for you than it might be in delaying. Okay, keeping in mind, and if you had a prospect for working and working more hours and picking up more pay and being able to delay Social Security, you would get a bigger payment. But again, at least based on those facts, maybe taking early might make more sense. This again, without knowing, when I do an analysis for a client, okay, I get into a lot more questions as far as in gathering of information in terms of their total their total finances. But I'm going to guess from what you've told me that your situation is much more dire than where you need that extra income just to maintain a basic standard of living. So from that standpoint, probably does make sense.
Because I was in the 2010 flood in Nashville. I was living in the tent city and stuff. And, I got a Section 8, and the VA, they helped me to get all my little medicine and stuff, which it ain't a lot of medicine. It's just high blood pressure and arthritis and stuff like that. And I get all that free.
Okay.
It would not affect nothing?
No, Social Security is not going to impact that. And it's not until age 65 when you qualify for Medicare that you're going to get into the health care issues.
So the best time is just going to file at 62?
So, yes, sir. Antonio, based on what you've told me, you need the money pretty badly, and if this can help you get off the streets and get into a safer environment, that certainly makes sense as well.
All right, thank you. You all right, man. You all right. Thank you.
Take care of yourself. Good luck.
All right, you.
Yes, sir. Bye-bye. Okay, one of the things that, and this is a tough situation, and you feel in particular for somebody who served our country and is, struggling in this manner, and this is one of the areas that, it's so important that when you're planning, some of the things to think about is when you look at our economy and you look at how much people are struggling and you look at, in fact, some of the impact there. Recent article, for instance, I think it's somewhere around 45% of people in the United States pay no taxes whatsoever. So when you look at the impact, okay, the fact that half the people are paying all the income taxes, and in fact, I think the highest 20% of earners paying 90% of that. When we look at the debt and the budgets and the way things are working, we got to look at the impact that's going to have on all of us as far as potential raise, higher taxes, and what that might mean with regard to our benefits that we're going to receive. And that's why really planning can be so important. There are going to be some other headwinds that are coming economically that if we plan well, we can weather these quite easily. But without proper planning, we could find ourselves behind the eight ball. I've seen bad decisions made where new clients come in, and after they've already taken money out, for instance, of a retirement account and paid heavy taxes, much more than they would have otherwise, and it may have been they were thinking, I just want to pay off these debts and I want to get this taken care of, so I'm just going to pull this money out and I'm going to do that. And all of a sudden they paid 25% tax on money that we could have accomplished the same thing but just spread it out over a few years and only paid maybe 15% or less in taxes. So this is something where planning can, again, be so important, but before you do those things, that's when you want to come see me, okay? And we're going to make that available again for the first 10 callers to my office, 615-376-5325. Full financial plan, going to help you with the decisions and let you know before you make that call what that's going to mean to you and to your, the net result. How much is that going to affect you? Are you going to end up with a lot more in taxes? Are you going to end up with a lot less money? We can show you 10, 15, 20 years down the road how much money you're going to have based on the decisions you make today, and then we can show you alternatives and share strategies with you to show you how you can improve your situation, how you can make more money and pay out less in taxes, how to avoid penalties, how to make good choices when it comes to your Social Security and Medicare. This can be worth tens, maybe even hundreds of thousands of dollars making the right decisions here. And this is one of the areas that I can't emphasize enough. Getting it right the first time is so important because it's so hard to fix mistakes. A lot harder to do that than it is to start out on the right foot in the first place. All right? So again, for those that call in, I'll also send you a copy of my book, 7 Steps to Financial Freedom in Retirement. Cover a lot of information in there, and that again is all yours. So it's a full financial plan for those first 10 callers. We're going to get into more about Social Security. I want to delve into, in particular, those health care costs, because that's one of the areas making the right decisions can be a huge difference in saving you tens of thousands, again, maybe even hundreds of thousands of dollars in your retirement. All right, so we're going to take a break. When we come back, we're going to get into that and more. Join us here. We'll be right back on the Retirement Report.
I'm Talia. As the mother of 2 young children, I know that the March of Dimes helps all babies get a good start. That's why I'm proud to support the March for Babies. I hope you come and walk with me. Let's support the research and programs that help our babies. Please join me. Sign up at marchforbabies.org.
CBS this morning.
From your news and information leader, this is a News Channel 5 update.
Good morning, guys. According to the Robertson County Sheriff, the two suspects hit stop sticks in Springfield and their vehicle fell apart on Highway 25. This comes after police were pursuing two suspects they say was involved in a Clarksville shooting, and it ended right here. Let me punch camera one at East Robertson High School. That's where the male suspect ran to after his car started falling apart. He has been identified as Elijah Hughes, who took off on foot here and again ended up in an empty school bus at East Robertson High School. The second suspect who was arrested was identified as Tiana Holmes of Clarksville. According to Clarksville police, one of the suspects fired shots on Timber Court, that is in Clarksville. And back out here to me now. We are still working to gather more information. We've reached out to Clarksville police, the Robertson County sheriffs, and we're trying to find more information. We'll alert you to that as soon as it becomes available. Reporting live in Cross Plains, Alexander Cohen, News Channel 5.
Ladies, at Marty and Liz Shoes, thousands of pairs of designer brands you love, all 50 to 90% off those mall prices you hate. Nine West, Jessica Simpson, Vince Camuto, Clark, and more. Huge selection. Awesome deals, even for men, at Marty and Liz Shoes.
We're keeping it awesome at the all-new Franklin Kia this month and giving you up to 20% off. All new Kias in stock.
That's awesome.
Forte, Optima, Sorrento. Come to the all-new Franklin Kia and get up to 20% off. All new Kias in stock. Brand new Kia Soul up to 20% off. 2016 Kia Sportage up to 20% off. 20% off a new Kia Cadenza means you're saving $9,000. Come in all new Franklin Kia this week and get up to 20% off your new Kia. Franklin Kia, keeping it awesome.
I've just picked us up 2 breakfast croissants for $4 when this bear attacked. With one swipe, it devoured one of the croissants. Then Jack showed up and took care of the beast so I could escape.
And that's what happened to your breakfast croissant.
And yours?
It survived.
Enjoy freshly cracked egg with ham and bacon or sausage. 2 tasty croissants at an even tastier $4 price. It's a deal you'll devour.
Ladies, at Marty and Liz Shoes, thousands of pairs of designer brands you love, all 50 to 90% off those mall prices you hate. Nine West, Jessica Simpson, Vince Camuto, Clark, and more. Huge selection. Awesome deals, even for men, at Marty and Liz Shoes.
5 Live traffic at 8:27. Traffic volume has settled down. Still a number of crashes working. Here's one. It's on the right shoulder of I-40 there under the Spence Lane overpass on the east side of town. If you're coming in from Hermitage, though, not slowing you down. A 14-minute drive time to downtown Nashville. This crash on the right shoulder of I-24 eastbound on the east bank here at Shelby Avenue. Again, lanes of traffic are open, so it's really not slowing us down much. We do have a handful of crashes still on our map. Have a safe traffic weekend. That's 5 Live traffic.
Thank you, Dave. Right now in Nashville, we got sunshine. Your morning is off to a nice start. 43 in the Music City. Winds are calm for us at this hour. As we go through the day, a sunny start, but clouds will begin to stream in a little bit later in the day. Our camera now from First Tennessee Park, sponsored by the Sounds. 49 now after a morning low of 43. So for today, we'll look for a high this afternoon to make it up to near the 70-degree mark. Winds east at about 5 to 10. Shower chance tonight, the better chance for the showers coming in after midnight. Your 7-day is on the way.
There was a time when I battled with the best, met with the meanest, trained with the toughest. Maybe I'll stumble, never to recover. To strive, to seek, to find, and not to yield, but I will fight it when I wake. I will never surrender. I will come back strong.
Watch News Channel 5 this morning, weekends starting at 5.
Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. We're going to jump right on the phone, and this is Frank. Frank, welcome to the Retirement Report.
Hello.
Yes, sir. How can I help this morning?
I had a question about, I've been retired, I'm 68, and I can't work anymore. Can I still get a little help from Social Security?
Are you receiving Social Security benefits now?
Yes, sir.
Okay, and of course you're receiving your Medicare benefits.
Right.
For health care. When you said, are you looking for additional help?
Yeah, because I can't work at all now.
Right.
And I wondered if I could draw disability.
Past the age of 68?
Yes, sir.
Usually you're going to have one or the other. Okay, so the fact that you're already collecting Social Security, how long have you been collecting your Social Security benefits?
Since I was 63.
Right. Okay. One of the things you could go down and check, I don't know if this is going to help you at all, Frank, but it wouldn't hurt to go to your Social Security office and talk to them, and only from this standpoint. How long have you been disabled?
Just past year.
Okay. I mean, you can go ask. Normally, Social Security disability benefits may be higher. Usually it's going to be closer to what you would have received had you delayed taking Social Security until you reach your full retirement age at age 66. So it might have been a higher benefit, and then it would have, in fact, locked in. Now, because you had already started taking Social Security, and because, in fact, you're already past that full retirement age, and you have received some cost of living adjustments, though probably not much in those 5 years, it doesn't hurt to check basically, but I'm not sure that there would be any additional benefit available. But I would at least make the call, or go even better, go in to your local Social Security office and talk to them directly.
Okay, sir. I do appreciate it.
Yes, sir. Wish you well.
Have a good day.
You too. Thank you. Bye. All right. One of the areas when we come into Social Security, some things that I want you to understand. This is the health care part. All right, we talked about, again, when to take Social Security, 62, 66, or age 70. Now, here's something else to keep in mind, and this is your Medicare. When it comes to the health care decision, we're going to put up a slide, Healthcare Dilemma. Managing the cost of health care happens to be one of the most complex issues facing society. And I have many clients come in and trying to navigate what decisions to make, so I'm going to break this down for you to try to make this a little easier to understand, and for you to plan in advance about the kind of decisions you're going to have to make and what kind of transitions you're going to have depending on whether you work past age 65 or not, and when you start taking at Medicare, what choices to make. So again, likely among your greatest expenses in retirement is going to be that of health care. As I mentioned, between $200,000 to $300,000 is the estimate for out-of-pocket health care costs. Medicare itself does not cover everything that you're going to need for health care costs. And it ranks, of course, as one of the top concerns for retirees and pre-retirees is how to cover this cost. So let's go to the next slide. All right, this is the healthcare dilemma, and this one, the heading is healthcare spending has far outpaced inflation over the last decade. So if we can get that up, I want to show you these numbers when it comes to inflation. So do you see that one, Marilena? Because this can have a significant impact on your finances. And let's go on to the next one here. The next slide, which was healthcare spending has far outpaced inflation over the last decade. What you're looking at basically is inflation over the last 10 years at about 2.3%, with healthcare at about 5.8%. Okay, so more than double, well more than double, 2.5 times in fact, the rate of inflation is how much health care costs are going up. All right, and it can have a significant impact on your finances. You're looking at 38% of people in this nationwide survey having difficulty paying bills, 27% using up their savings in an attempt just for medical costs as an effect of that, and 16% of folks even having to borrow money to cover these health care costs. So this is how severe the problem is. And I've got, let's see, one of the areas when it comes to Medicare and making that right decision has to be with understanding just how much that's going to impact you with regard to your finances. So let's take a look at the next slide. This is the Retirement Income Challenge. It's the percentage of private sector workers employed by establishments who still offer health. See, it used to be just like with pensions, that when you retired, you would also have health care benefits that you would continue to receive through your employer, and it would dovetail with your Social Security Medicare benefits and help cover those out-of-pocket costs. That's no longer the case, unfortunately. All right? So, in fact, if you look at this graph, and that's the next slide, Marilena. So in this graph, the Retirement Income Challenge, percentage of private sector workers employed by establishments offering health insurance, you can see by the graph how much that continues to drop and has since 1997. Basically over the last 15 to 20 years, this has gone down, down, down. In other words, employers are not providing the cost. So let's look at the next slide, healthcare dilemma. Consumers estimate, this is a survey that was done where people were asked, how much do you think your annual health care costs in retirements is going to be? And as you can see from the numbers, that for many people they thought, well, 26% of people said they had no idea what it was going to be. 16% of people said they thought their out-of-pocket costs would be probably, maybe $0 to $1,500, and that's we see a lot of people. So and then 12% $1,500 to $3,000, 25% $3,000 to $6,000. So you see that more than half of the people surveyed, almost 3/4 of the people surveyed, in fact, had a very did not understand, or underestimated, if you will, how much health care costs were actually going to be in retirement. So I'm going to break this out for you so you can see how Medicare actually works. So there are myths, if you will. So we're going to compare the myths about Medicare versus the facts. All right? One of the myths is that Medicare will cover most or all of your expenses, your health care expenses in retirement. It doesn't. In fact, it covers only about 62%. Okay, that means you're covering almost 40% that you're responsible for. Medicare will cover my long-term care needs. This is another myth. Medicare does not cover long-term care. It will not cover home health care. It will not cover assisted living. It will not cover nursing home care. Even rehabilitative care is limited in terms of how much coverage you can expect from Medicare. And even there are certain rules that you would have to fit into to get any kind of help. And that what I mean is simply this. If you had need of Medicare to cover a rehabilitative or long-term care need, the most you could hope for is 100 days, and that's if you had a hospital stay, and there are a lot of other rules and check-ins that go through that 100-day period to continue to qualify. Okay, so understanding health care expenses, if you take a look, Medicare cost-sharing provisions, 45%. All right, premiums, and that means your deductibles, your co-insurance, and the like. And then there's the premiums you have to pay for Medicare. On your Part B and Part D, that's another 32%. And then your out-of-pocket costs for prescription drug expenses, 23%. So again, as you see, the out-of-pocket health care estimates for a 65-year-old couple could be as much as, they're talking $250,000 to $400,000 over 20 years in retirement. Okay, so 65 to age 85, that's what you could expect for health care costs out of pocket. All right, what you would have to pay. How do you cover that? Well, first it starts with understanding how Medicare works. So option one is the traditional track, if you will. Original Medicare is Part A and Part B. So let's go to the next slide. And I'll show you basically the two tracks that are available to you. One, again, original Medicare Part A and Part B. So you sign up for Medicare at age 65, you automatically get Part A, which is the hospitalization, and then Part B costs a premium. That's for your outpatient. Then you have secondary insurance. All right, this could be, for instance, a Medigap policy, Medicare supplement policy. Next, you would have your prescription or Part D coverage, which is an elective, and again, you're going to have premiums and deductibles on that. We're going to compare that then with Part C or Medicare Advantage plans, which can help cover all of these things. So those are the two options. Options 1, option 2. We're going to break those down for you to help you understand what those options, which one you elect, what impact it can have on you as far as your expenses in retirement, that out-of-pocket cost, and how we can greatly reduce those. All right, so join us here. We'll be right back on the Retirement Report.
Middle Tennessee has spoken. Ponce Law was voted Nashville's best law firm in the Tennesseans Toast of Music City Reader's Choice Awards. Thank you, Nashville, for this incredible honor. For over 20 years, Ponce Law has been working to provide excellent legal services to clients and outstanding leadership to the community. Voted best law firm. Proud to serve the nation's greatest city. Nashville-based, Nashville strong. Ponce Law, justice for all.
When most of the world is calling it a night, you are just starting your day. You are a night owl, preparing breakfast for the early birds. It's 4 a.m. Your customers aren't up yet, but your news leader is. And when the rest of the world wakes up, you will have fresh donuts waiting. News Channel 5 this morning, the official news of morning people.
What could you lose in a home fire? Your possessions? Your home? Your memories? Don't let your world go up in smoke. Make sure you have working smoke alarms. And keep children 3 feet away from anything that gets hot. Because fire is everyone's fight.
You expect to know right now.
We have breaking news coming in.
And even though the world buzzes with breaking news, it's still important you trust where breaking news is coming from. Take News Channel 5 with you wherever you go to be the first with the stories that matter to you. Something is always happening. Know now, know for sure. Trust the experience of a leader. Your news and information leader. News Channel 5.
Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, I want to get into this Medicare thing. With the decisions you make about Medicare and understanding how Medicare works can be so critical in terms of keeping more money in your pocket. All right, less of that money getting paid out for those health care costs, which can be quite high. And as I mentioned earlier, they're going up at a much more rapid rate. And when it comes to this is one of the areas I talked about, risk in retirement. Inflation is one of those big risks. And one of the things when you apply it, you think of inflation and say, well, inflation's really low, but think of what your out-of-pocket costs are going to be for you personally. In other words, as we get older, okay, as we get into retirement, the kinds of things we spend our money on, we can't look to just a CPI, the Consumer Price Index, or CPIU. We have to look more towards what we actually spend money on, more represented with an everyday price index. And one of those is health care. And health care is going up at a rate of 5.8% per year. When you're looking at inflation under 2 or 2 or less, and you look at that in comparison over the last 10 years, that's a huge difference. And that's one of the things that's going to dramatically impact you, and it has to do with why you have to be so smart with your money. All right, before I get back into this, we're going to take a call again. Ken, welcome to the Retirement Report. Do we have Ken? Did I lose Ken?
Yes.
Oh, there you are. Okay, hi Ken, how you doing?
All right.
Good. How can I help this morning?
I have a question about Social Security.
Okay.
Does it end when you die, or does any benefit go on to your spouse?
It depends. Everything depends on the situation. So if you and your spouse are both collecting Social Security, then and the first of you passes, then Social Security is going to look at who is receiving. Basically, you're going to get your benefit plus potentially a credit. In essence, what it amounts to is it'll be the higher of the two payments, but one payment will go away.
one will go away. Okay.
All right. So if an example would be, now they do the calculation a little different, but I'm just going to simplify it rather than get into how they do the calculation to just tell you what the end result is. And the end result is that the surviving spouse will receive the higher of whatever the two amounts were.
Okay. One other Social Security question.
Sure.
Is there a death benefit?
Some kind of lump sum, you mean?
Yes.
No. This is one of the, and this is a great question. Let me take this opportunity to mention something. Social Security has been called one of the greatest annuities of all time, because in essence what it's doing is it is an annuity income. It's providing you a stream of income, stream of monthly payments for as long as you might live, potentially additional benefit to a surviving spouse, all right? And there are some other things we won't get into, but just on that part of it. But here's where it compares similar to what, if you understand annuities, there are immediate annuities, there are deferred annuities, there are fixed annuities, variable annuities, so many different types of annuities. But the one we're talking about here would be more like an immediate annuity with a life-only payout, or for a couple, that would be for the 2 lives. Okay, but when it's gone, once both people have passed, then there's nothing left. There's nothing else to be paid out to beneficiaries. Now I mention that because one of the things we're seeing too are private annuities, tax sheltered annuities, TSAs. Many nonprofits and teachers and such have had these for many years. Pensions are another form of an annuity, and again another form for the most part of a lifetime annuity, meaning that single or double life. You could have, it will pay out for your lifetime, or for a spouse you can have survivor benefit to where it would pay some amount to them as well. However, there's nothing left again when you're gone, okay, that would go to your family. And this is where private annuities, like a deferred annuity, can be different. You could get that same kind of income guaranteed for life for you and for a spouse. You can have a 100% survivor benefit where it would continue to pay as much to them as it paid to you. And here's the best part: if whatever money you put into that annuity, if you didn't use it up, if you didn't spend, you know, it's called longevity insurance is one way to look at it. Okay, because imagine, God forbid, if you died early on, both of you, okay, whatever's left in there, whatever money you invested, whatever's left will still go to your heirs. All right, that's one of the big differences, and it's a huge difference between a pension and Social Security. All right,
yes,
is that there could be some remainder amount. And here's the other part: if you live, and this is one of the biggest fears people have, Ken, is that they're going to outlive their money, right?
Right.
That you run out. And that's where longevity insurance, why we refer to it as that, because no matter how long you live, okay, even if the underlying money that you invested in there eventually ran out because you lived to be, 90 plus years old and used it all up, okay, they'll still continue those payments. And in some instances, you can even get inflationary riders on those that'll pay you not just the, some flat amount, but it'll increase those payments over your lifetime and that of a surviving spouse as well. So even if the money, you're guaranteed to never, ever run out of money. This is why income, guaranteed income, is so important in retirement. Does that help?
Yes, it does. I have heard that there's a nominal amount, like $250 or something, that
a funeral expense
a family receives when
right.
a person dies.
Correct. $250. So that's, not that, I would, if we think about it, we don't really consider those kind of things too much, do we?
No.
That's not going to be any impact in terms of anybody's life, is it?
No, it isn't.
Yeah. What we're
Thank
looking
you.
for. Yes, sir. You're welcome. I hope you have a good day. And again, one of the things to keep in mind when you're looking at making it, this is why making a decision about when you take Social Security, how much you have, in particular for your spouse, and that can be so important. So, all right. Have a great day. Thanks for the call.
Thank you.
Yes, sir. All right. Then we have Gene. Gene, welcome to the Retirement Report.
Good morning, sir. I got a question regarding my 401k.
Okay.
This money was put in there before being taxed off my payroll, and if I die,
right,
does my heirs get that money without having to pay taxes on it?
No, I'm afraid not. Not if it's a traditional 401k. Some things you can look at. I mean, this getting into tax planning, the only way you can do that, or if you want to leave tax-free money to your heirs, there are some things that you can do to accomplish that goal. Roth conversions are one. There are some other strategies that we employ with my clients that can help them, and we do, but you don't necessarily, doesn't mean you're going to pull that whole 401k and roll it all in and convert it all in 1 year. That could potentially cause you to pay a lot more in taxes. But I have a number of clients that we have that we're doing conversions, Roth conversions, where we're doing a series of conversions over a number of years. And we're able to convert a little bit every year, and in doing so minimize the tax impact on those conversions and create a nice tax-free account, whether it's for legacy purposes or for later in life, being able to access tax-free income. So it can be a big benefit. It's one of the things, though, again, we look at each individual situation. We do the analysis. It's a part of the planning that I do with my clients, and it's part of the analysis that I offer up each week. So, for instance, if you call my office and you want to come in, one of the first 10 callers, do up a complete plan, and that would be another way to look at how do we minimize taxes on those retirement accounts.
Absolutely, I need to do that. I just retired last weekend, so I got a lot of,
A lot of decisions to be making, you're right. This is going to be a critical time for you. The right decisions can be huge in terms of how much money it's going to be for you and for your family.
Well, I'm thankful that you do such a beneficial program, and, and it helps out a lot.
Very kind. I appreciate that a great deal. Well, call my office, 615-376-5325. Debbie will get your information. She'll send you out a checklist of things to bring, like your 401k statement as an example, and we'll do up a full comprehensive financial plan analysis on your investments, on how to minimize taxes, maximize Social Security, how to cover those health care costs in retirement. All of that is a part of the plan. And we'll send you out a copy of my book, 7 Steps to Financial Freedom in Retirement. And I cover a lot of the strategies we talk about in the book as well.
I'll definitely do that and take advantage of that. And you have a blessed day. Thank you.
You too, sir. Thank you very much. All right. This is one of the areas I love what I do, and God willing, I'm going to be around to do it for a very long time because I can't imagine doing anything else. Let me go back to now, and one of the areas this in my field, there are so many things that are constantly changing. One of those being with regard to Social Security. Okay. The ability to file and suspend, the ability to do a restricted application. These are a couple of things that have changed recently, but they are still on the table depending on your ages and where it's looking at. We've got to keep up because of the changes that are always going on. Understanding Medicare is a big part of that. This is another area where there have been many changes. The taxation of benefits. When you get into Medicare, looking at your Medicare premiums and the impact that income can have on those Medicare premiums. There are so many little gotchas in the tax code, okay, that can really trip you up and cause you to have to pay extra tax beyond what you might be aware of. All right, I've had times with clients where they've come in and they, unfortunately, maybe they got bad advice from a prior a tax person or advisor, and they found themselves taking, doing whether it was a Roth conversion or selling off, some property or a stock portfolio. And they find themselves with all of a sudden triggering some taxes like an alternative minimum tax or net investment tax. And these taxes, all of a sudden, where they thought they were only going to be paying 15%, all of a sudden they find themselves up paying 20% capital gains, plus these other taxes that triggered higher taxes for them. This is the same thing when you're making decisions with regard to your Social Security. Are you going to be triggering potential tax issues there? If you're doing Roth conversions, why we do an analysis to make sure that we do it right and that we do it in advance. We do the planning so that if it is going to have a negative impact, if it is going to cause you to trigger additional taxes on your Social Security benefits or trigger other potential taxes like AMT and such, we're going to pick up on that before we make that move, and we'll minimize that by just reducing the amount we convert. And so that we can still accomplish the goal of minimizing taxes, creating tax-free accounts, take care of legacy issues, but we do it in a very intelligent way because we do the tax returns in advance, okay? We run the numbers before we do the make the choice or make the decision. And this is with everything. When you're talking about what you're going to do on your Medicare decision, this is one of those that comes in. The traditional track that we talked about, right? Medicare A, B, D, and a Medicare supplement plan, or do we want a Medicare Advantage plan where it covers all of those in one through a private carrier? And what's the difference? Well, we're going to take a break. When we come back from this one, I'm going to dig into the difference between that first track and the second track so you can see which one's best for you. Join us here. We'll be right back on the Retirement Report.
Time does not build trust. Outstanding journalism over time builds trust. Every day, every year, every decade, you get our best. In breaking news,
let's go right now to
investigations,
what happens to the public's money,
severe weather coverage.
To your safe place right now.
There is only one leader. News Channel 5 is your #1 source for news. Your news and information leader.
Money, sleep happy.
After a cool start to your Friday morning, things are looking nice later today, although I will note clouds streaming in later today, but temperatures still on the mild side. 69 this afternoon, 45 tonight. For Saturday, showers in the area, 54. Better chances in the morning, but another disturbance brings in a shower chance on Sunday morning, maybe even a passing snowflake for the beginning of spring on Sunday, and then temps rebounding to 70 next week.
I'm Eric Compton, professional golfer.
I'm Sam. I play pro soccer.
I'm Eric. I play basketball.
We are all alive and healthy today because people chose to be organ donors.
You too can donate life.
Currently, there are more than 123,000 men, women, and children waiting for an organ transplant.
I made a difference and became a kidney donor. You can donate life too.
You have the power to donate life. Visit donatelife.net.
Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, we've been talking a lot about Social Security and, of course, about Medicare this morning. And one of the areas, and we've run out of time, unfortunately, so I'm not going to be able to dig in as deeply today. So we're going to have to push this off for the future. But about Medicare, the traditional track again, Medicare Part A, Part B, Part D, and then Medicare Supplement Plan. The plus side, one plus side I'll leave you with is that does give you free access to any doctor that accepts Medicare. Medicare Advantage plans are more of a preferred provider organization, so a little more limiting, but as long as your doctors are in that organization, there can be some tremendous savings for you there, okay? Something to keep in mind. Hopefully this has been helpful to you, and I want you to join me here each and every week on the Retirement Report.